Dear viewers, subscribers, budding nursing and paramedical professionals, Assalamu alaikum warahmatullah. Welcome back to your own channel, Advanced Nursing Theory and Practice. Today, we are going to discuss the topic of qualities of a professional nurse. Here, both personality and leadership qualities, or we can say characteristics of a nurse, will be discussed. This topic comes under the heading of subject nursing foundation, and this will be discussed by me, Nurul Amin. We must know there is not a single quality that qualifies a person to be a nurse and enter in the profession, but there are vast number of qualities or characteristics and etiquettes that we learn in various subjects, that we learn under various headings, so that they can qualify to be a professional nurse, or that makes a professional nurse complete. We will discuss here some of the qualities that are included in personality and leadership. Number first is caring. Caring is the ability of a person to show concern for others. So the nurse should show concern for the patient, for his or her needs, and should take every step to make him or her happy. She or he should take steps that will mitigate the sufferings of patients. So caring is one of the leading quality that a nurse should possess. But caring is not the only thing or quality that will make people to enter in the profession of nursing. There are other reasons for entering in the nursing profession, like employment, like career opportunities, like supporting the family, etc. Number next is communication skills. As we know that nurse has to communicate not only with the physicians, surgeons and other healthcare team members, but they have to communicate with patients, their attendants, their relatives and visitors. So communication is the ability of person to pass on message in a feasible and clear manner. So, if we do not communicate effectively with healthcare team members or patients, then there are chances of various errors, which we call as communication errors, and these communication errors lead to the uh, arise of other errors like medication error. There can be misinformation, interpretation errors. The patient may feel neglected or patient may get neglected. There may be inability on part of nursing professional to prioritize his or her plan of action. Then there may be unsafe care. Malpractice and negligence can also arise due to lack of communication skills. Then next is empathy. Empathy is the ability of a person uh, to be in the shoes of other. Simply it means feeling the pain by placing himself or herself uh, at the place of other. So this will make us to learn what patient is going through, what the attendants are going through, and what care we expect others to provide us. So care is to be provided as per that concern or that level and that need. Empathy is always followed by sympathy, and once a nurse is sympathetic, she will have to be empathetic as well. This must be we can say this must be boosted by this honesty as well. Number next is attention to detail and active listener. Nurses do not have to pay attention to physicians, then surgeons, healthcare team members, but they have to pay attention to patients and attendants as well. So they should utilize their knowledge skills. They should utilize their critical thinking, critical judgment, in order to provide highest care to the patient. Moreover, we must know that a nursing professional should attend verbal and non-verbal communication of the patients, so that they can know from them what they need, what they want to tell us, and whether verbal and non-verbal communication are in line or not. That will tell us what patient is actually going through. Then nurse do not have to attend only one patient, but there may be a large number of patients which she or he has to attend. So it is very important to maintain the communication skill with multiple patients when working in a particular area. Then there is problem solving skills. While nurses are being trained at the graduate or postgraduate nursing program, they are taught the education component that is prescribed by a apex body. Problem solving skills and training are taught to them by institutions where they are being employed. So on job training is most important, and helping them to identify various alternatives to solve the problem is also important for them. So nurses must be aware of the alternatives and the solutions that they can apply if one solution is not working. So when they find a problem, they should have a basket of options from which they can choose and solve their problems. So this is one of the part of the quality or trait of a professional nurse. Then energetic and stamina. We are well versed about this, that nurses do work very much in the wards, and they have to maintain resters, they have to go for the documentation, they have to give medication, they have to move here and there along with the patients, they have to move from bed to bed in order to administer the medication and provide care. It has been roughly estimated that a nurse lift is an average of 1.8 tons of patient load while lifting and adjusting them. Then it has been also suggested by some other studies that a nurse walks nearly about 4 to 5 miles per shift of 12 hours. So this tells that a nurse, professional nurse, should be energetic and should have great stamina in order to work in these kind of situations. Then sense of humor is also one of the quality, or we can say characteristics of a nurse. It is only used in order to spread the positivity among patients, their attendants, co-workers, and family members of patients. This means that nurse leader is, or nursing professional is also a human, and they have to support patients in each and every possible way, and make the patient and attendant happy to get rid of anxiety and stress they suffer due to weakness or illness of the patient. So this will ultimately increase the trust of patient and attendants on the nurse, so that they can open up and share their concerns regarding the patient's health and wellness. Then patient advocacy, it is one yet another quality of a nurse, that she should or he should uh, he should work as an advocate and speak up for the patient's rights. If she or he feels that patient is not receiving right care, he has to fight with or take up the issue with concern, so that appropriate care and appropriate care can be provided to the patient. So nurse practices with the strong patient advocacy, and they simply fight for the best care of their patients. Then next is willingness to learn, or continuing nursing education. Continuing as we go through the various programs like bachelors and masters, they are being taught about the theory component, but in practice they get deviated from it, and it is very essential that a professional nurse should be motivated and willing to learn from continuing nursing education programs, be it orientation programs, in-service education programs, workshops, seminars, webinars, whatsoever. So they should take some time. Their institution should uh, their institution should what we call as establish some sort of activities that they can increase their knowledge and get acquainted with evidence-based researches on current trends and practices going on in the global scenario. Then critical thinking. While having a strong willingness to learn is an important skill in the good nurse, putting that knowledge into successful practice requires the ability to think critically. So nurses have to think critically during high stress situation, and they have to think which option is to be selected at what time, and simply this critical thinking is this critical thinking is one of the most important characteristics of a professional nurse. Number next is time management. So we have seen that a nurse has to work in the ward, and she or he has to manage various uh, activities in the ward, like she has to administer medication to the patients, she has to maintain the records, she has to she has to make she has to set plan, she has to prioritize the care. She has to manage her own time so that they can provide best care to the patient. So time management is of great importance. As from the picture you see that what kind of activities she has to manage so that nursing care planning and interventions can be taken accordingly. Then leadership. Nurses, professional nurses, I should say that they are able to transit from traditional roles to leadership roles, and this leadership role comes after uh, after training, development opportunities, and sufficient support and mentorship. And this should be one of the quality or characteristics of a profession. They should be able to become the leadership by gaining such kind of qualities. Then experience. With each passing day, we practice as a clinical nurse or bedside nurse, we gain some experience, and these experiences gained can be utilized in supervising and transferring our skills and knowledge to our juniors. And experienced staff will be a asset to an institution. So once we say that it is a quality of nurse, it means that this quality can be transferred to others. Number next have we have is surrogate. Nurses should work as a surrogate when patient feels all alone, and nurses should provide care just like brother, sister, and mother. We must know here that it's not to be considered as a negative way, and we have uh, never have to propagate it. So only those roles we can take that are permissible and feasible. The next is patience. Nursing professionals should be patient while dealing with the clients and providing them care. They should listen to the patients, attendants, and others so that they can plan for the nursing care and provide interventions accordingly in the right mode and method. Then at the same time, nurses must not take on their personal safety, integrity, and respect. They should not bear any abusive or bullying language or actions from the attendant side or relative visitors side. They have to report it accordingly. So there is a fine line between patience and attack on the personal safety and integrity and respect. So we have to look upon it. These were some of the qualities of a professional nurse that she should possess. There might be a lot of other qualities that you will go through in the books. Mm, so mentioning these are must. So with this we have completed today's topic. Thank you very much. Do not forget to share, subscribe and support your own channel. For suggestions you can mail us on ameenhabib3@gmail.com and ejazmanzoor.ahmad@gmail.com. Thank you for being with us.